We continue with some health concerns, and to be specific, in Garisa County, which is recording increased cases of malnutrition due to the severe drought being experienced in the Horn of Africa region. This has led to the poor growth and physical development of children. Ruth Munyi was in Lagdera sub-county in Garisa and shares the impact of this situation.
The drive through the clear tarmac to Modogashe town, Garisa County, may portray a picture of a well-developed region. But as we drive past the tarmac road and onto the Maram road, we get a feel for the situation here. The area is dusty, an indication that the grounds have been dry for a while. And the dry situation has had a major impact on the health of the residents in Lagdera sub-county, especially the young ones. Falhatho Khalif meets us at Modogashe Sub-County Referral Hospital. This has been her home for the last 3 days. A 16-month-old baby had just been admitted, and she was advised to stay at the hospital with a baby. Her 16-month-old baby is getting a regular checkup. The nurses here are checking his weight. The boy has suffered severe malnutrition, which posed a great danger to his development. Falhatho, a mother of 4 children, was unaware her child was suffering from malnutrition.
My baby was severely malnourished. He has been admitted due to other complications.
The hospital has been dealing with the issue of malnutrition for a long time, and there are contributing factors that accelerate this situation. Shamat Yusuf, a nutritionist by profession, knows that the drought situation has contributed to the increasing cases of malnutrition here.
One of the things that affects children is because the source, we are pastoralists, and most of our animals are dying during this drought season. If you look at the peripheries, the cows are dying, water pans are drying up, and people are coming to town because they have lost their livelihoods, a source of livelihood.
Falhatho is hopeful that her son will be discharged soon. Her husband is full of despair. He sits down at the compound full of thoughts. This is a new phenomenon to him. He is not used to being at home at this hour. Mohammed is the sole breadwinner of his family. Financially, things have not been looking good. He is concerned about how he will pay the hospital bill. Mohammed suffered a huge blow when the drought struck the county. He is counting losses.
I had 300 goats. Many of them have since died because of the drought. Only 30 goats have survived.
The first 2 years of a child's life are critical for development. Therefore, the emphasis on proper nutrition.
Nutrition is quite critical in terms of the brain development of a child. A well-nourished child will be able to perform better in school. A well-nourished child will be able to fight diseases and become healthy.
Garissa County is recording an increase in the number of severe malnutrition cases reported between the months of January and March. According to the records at Modogashe Sub-County Referral Hospital, the number of severe malnutrition cases reported between the months of January and March were: in January, they recorded 123 cases, in February 170 cases, and in March there were 131 cases. The total number of cases of moderate acute malnutrition reported within the same period was January 283, February 393, while March had the highest with 611 cases. This hospital has developed remedies to treat malnourished children.
If the child is moderately malnourished, we admit them a certain program called SFP, Supplementary Feeding Program. We give them a returning date of every 2 weeks. We give them a supplement called RUSF, Ready-to-Use Supplementary Feeds. After every 2 weeks, we give them 14 sachets. If the child is severe acute malnutrition, we give them RUTF, Ready-to-Use Therapeutic Food.
The county government has implemented measures to reduce the cases of malnourishment, and they have been very effective.
And then one other thing I've also noticed is more men involvement in asking, especially when we are doing radio talk shows. Men are also calling us in for questioning and telling us what do we do about child breastfeeding, for example, complementary feeding and all that.
UNICEF has supported the county government to expand outreaches and ensure malnourished children can be treated, especially during this drought season.
So we are working with the County Department of Health under a program which is called Baby Friendly Community Initiative. This program is geared towards empowering the caregivers, the household members, to be able to adequately take care of their children, to ensure that they are well nourished.
Garissa County is currently experiencing prolonged drought as a result of 4 failed rainy seasons. This has had a direct impact on the health of children in this particular region. Now, the county government of Garissa, together with its partners, have recorded increased cases of malnourished children. They are now treating these cases to ensure that these children live a healthy and happy life. Ruth Munyi, Modogashe Sub-County Hospital, here in Garissa County.